Hello, everyone. Welcome back, and we're going to finish up our impression discussion today and talk for the last bit about digital impressions. So again, this is coming right from your module, and it is page 12-11. And talking about digital impressions, we have the ability to use computer-assisted design, computer-assisted machining, which is where the acronym CAD/CAM comes from, in dentistry now. And we saw a really great example of this when our friend Annette came and visited our campus and brought her equipment along for us to practice with and to utilize in our laboratory. Using digital impressions does allow us to capture a digital impression of the preparation, any adjacent structures, and the opposing dentition and its structures, all with using camera abilities and no impression material inside the patient's mouth. This is required to have some sort of design software available in the operatory for the doctor and or the lab tech to design the crown off of the digital impression that was created, scanning camera, a milling unit for fabrication of the restoration. So that milling unit can be on site in the doctor's office, or that digital impression can be transmitted electronically to the laboratory, and then they can fabricate the restoration off-site for the patient if the doctor doesn't want to have that large financial investment in their practice. Other systems may have just a scanning camera with software to, like I said, transmit that digital impression or image to the laboratory. There are lots and lots of advantages to doing digital impressions for your patient. The first is no need for trays, adhesives, disinfectants, pouring impressions, packaging those impressions, and then waiting for them to be transported to the laboratory. It is all completed on site for the patient while they wait many times. The clinician can view the preparation at magnification. They can see the prep from multiple angles. They can rotate it. They can colorize it. They can enlarge it. It's a pretty remarkable piece of technology that we have in front of us. The doctor can detect under reduced areas, undercuts, uneven or rough margins. So before that restoration then would be sent to be fabricated, those inadequacies can be corrected by retouching those up while the patient is still there. It reduces remakes of restorations. Can be completed in one office visit if the office has all of the devices on site, such as the scanner, the software to create and design the crown, the milling unit, and the sintering oven to glaze the restoration. Impressions can process. The impression process is easier for the patient. Many times patients have a severe gag reflex, or they want to get their crown done in one visit versus having to take off work 2 times to get the impression and then come back for the restoration. They can do this all at one time. The impression and the milling of that restoration in one visit makes it much more palatable, if you will, for your patients. Time is shortened for lab work because of being done in the office, if that's available, and the digital impression is as accurate now or better than traditional impressions. And that is because if there is bleeding, we can see that and stop it before we take our digital impression. We don't have to wait for that impression material to set in the mouth before bringing it out and seeing, oh, there's a void because we had some heme present during that impression. There's no chance for voids for air bubbles or anything like that. You can see immediately if you have all of the anatomy that is required to make that prosthetic device. Disadvantages of having a digital practice in this regard is that it's a very huge financial investment for the practice. The cost of the digital scanner, as Annette stated, was around $100-something thousand. The milling unit was another 50 grand or $70,000, and then the oven, if that is required, of the material that is the doctor's preference. That's another several $1,000 unit of equipment to have sitting at the office. So if the practice is not really into selling the products that this device can produce, then it's going to be kind of a waste of the investment of the practice. So everyone has to be invested into promoting what the digital practice can do and what the benefits are to the patient, so the patient also finds benefit in what it has to offer. Another disadvantage is that the size of the scanner may present a problem for patients with limited opening. As you saw when Annette was at the office or at the lab and you were able to use that scanner, it was difficult to get in and around some of those areas, to get the proximal of the teeth that were near the preparation. It was difficult to get all of that with one nice, smooth impression from that digital scanner. It does take a lot of practice. There is certainly a learning curve with getting used to doing that digital impression. But that's with anything. There is a learning curve with learning how to also take a polyvinyl siloxane impression. So as you all were witness, that was my first time taking a digital impression, and I would like to someday become a little bit more effective at doing that, but it does take practice to get good at that so that we're not causing harm to our patient. And then if the lab charges for processing those digital images, that can be an extra fee on top of some of the things that we have sitting around in the office. But if you in your office have the scanner, have the milling device, and have the sintering oven, then those fees are reduced because they're all within the umbrella of your practice. There is definitely an expanded use of digital impressioning, and as time marches on, I truly believe that more and more and more offices are going to be going that route versus having impression material that the patient has to open up and bite down on or be held in their mouth before it's set. It's going to go away, just like traditional film radiographs have basically gone away. I think digital impressioning is going to be the wave of the future. And this is why.